Good afternoon, Ms. Renteria. My name is Jasmine, and today I'm going to be showing you how to do the central line dressing. Before we get started, we obviously need to check the doctor's order. We also need to be assessing when was the last time that the dressing change was changed, and we need to go follow our hospital's protocol into how often it needs to be changed. Okay. So what we need first, we need to gather all of our materials that we will need for this procedure. We're going to be needing a dressing change tray. When grabbing it, we need to make sure that it's not expired, that it looks intact and hasn't been tampered with. For instructional purposes only, this has been used, but we will make sure that we have a brand new one. I will make sure to have a saline flush, a clay, and the bio patch, and of course my gloves. So what I would do is I would knock, hand hygiene, give patients some privacy. I will come in. Good morning, Mrs. Smith. My name is Jasmine. I'm a Chafee nursing student, and today I'm going to be taking care of you, okay?
Okay.
So before we get started, let's go ahead and identify your name and date of birth. So, okay, Mrs. Smith, you were born since 24/1976. Okay, do you have any allergies?
No.
No? Okay. Are you in any time of pain right now?
No.
No? Okay. So, have you ever got your central line dressing change before?
Yes.
Yes? Okay. So before we get started, let me go ahead and explain to you what this is for, just so you could hear it again. We try to use this procedure to try to minimize the microorganisms that go into your central line, because we don't want any of that, to prevent infections, okay? Okay, so before we get started, I'm going to put this down.
So now we're gonna go ahead and pick up our bio patch.
Okay. And I'm going to set myself up to success. And I'm going to be opening up my sterile dressing. Okay. And I'm going to be, as Mrs. Smith, I am going to briefly pull down your gown, okay?
Okay.
While maintaining privacy for the patient. Okay, Mrs. Smith, so as you know, for this procedure, we're gonna need you to wear a mask to, again, prevent the unwanted microorganisms, so just to prevent anything from going into the site, okay?
Okay.
Okay, so go ahead and apply my gloves.
And now we're gonna go ahead and get our bio patch off the dressing.
Okay, so very carefully, getting it by the corner. Grab my mask. Okay, Mrs. Smith. I'm going to need you to face to your right, okay? Face away from the site. Okay? And then from here, we'll go ahead and remove my gloves.
And then we're gonna be
This
putting
in
up
here.
our bio patch and this scissors in the middle of the bio patch and then place it on.
And then at this point, I could drop my bio patch as such. Discard of this in the trash. Okay. Now I am going to start by
We're gonna keep this part
taking off the old dressing
and we're gonna hit down gate
by applying pressure to the sutures.
and now So now we're gonna change one of the enclaves for testing purposes. So usually we turn it off.
Okay. I'm going to discard of this. Next, I am going to be assessing the site, making sure there is no drainage, no redness, no inflammation, redness. Site looks intact. Let's go ahead and get started with this. So I'm going to discard of my gloves. To reuse them. Now I'm going to apply my sterile gloves. I'm going to start with my dominant hand.
Sterile. Twist. And then we're just gonna check.
It's not it, but I'll fix that later. My sterile glove, it ripped. I will grab a new one if on the actual situation with the patient. But since I am considered sterile here, I could go ahead and fix myself. Okay, now from here, I would grab my hydrochloric hexidine. I would pop it open, wait till it's saturated. I would then apply it on the center, as such. And then scrub for 30 seconds. 30 seconds. While doing this, I also want to make sure that before I'm done, swipe away from the tubing, as such. I'm done. And I could just dispose of my chlorhexidine, trash was here. So from here, I would apply my BioPatch. I will grab it with the blue side facing up into a taco. And I want to put it directly in the middle without touching, as such. Okay, now I can get my Tegaderm. My trash will be here. And I would apply it on the center. Making sure there's no air bubbles, especially here. Okay, from here it's not sterile no more. Next, I will make sure that my clamp, it's locked. Okay, it's locked. So now I will grab my saline flush and attach it to my clave. Attach it as such. Place it down. Then from here, I will grab my alcohol swab stick. I will grab my clave. Attach it. Trash. And I will use this and swab around my port, not inside, just around, for 15 seconds. Once that is done, that, grab my and then from here, my nurse would flush. I will not flush. After the nurse has flushed, I will go ahead and unattach it. Discarding my flush. The procedure at this moment is over. I could go ahead and let Mrs. Smith know that the procedure is over. I discard my gloves. Come to the trash. Hand hygiene. Mrs. Smith with her mask. Discard with the mask. Trash. I would bring the side of the row up. Okay, Mrs. Smith, we are done with this procedure. Do you have any questions for me? No? Okay, so from here, we will let Mrs. Smith know. If you have any questions, please don't hesitate to press the red button on your remote control.
You want me to use my phone to finish yours? No, it's done.
And
no, all right, well, does it have the safety word pushed all the way down? Yeah, she said that.
And before we finish the procedure, I would make sure that I label the dressing, and I would put my name, date, the date, or my initials, the date and the time that it was applied. As such, I will then notify my patient to press the red button if she needs anything. I would clean up my area. Then I would document how my patient took the procedure, how the site looked before applying the dressing change, and if the patient tolerated the procedure or not.